So generally, the natural history of an ankle sprain is you've been stepping down from a curve, or you've been running and jumping, or running on a bumpy surface. Perhaps a woman's wearing high heels. This will put you at higher risk, easier to twist. And you may have heard a popping sound at the time you twisted your ankle. Well, we know you sprained your foot. The first question is, can you walk on it now? That is a concern right at the time of sprain. If you cannot, clearly we're going to need some x-rays. Also, can you bear weight now? Perhaps is this 24 hours later, 48 hour, and is the swelling under control? I highly recommend that when a person sprains their ankle, they get off of it as soon as they can. They use an elastic bandage, an ACE wrap or a wrap, elastic wrap, and ice it down as much as they can. 45 minutes on, 15 minutes off for the first 24 to 48 hours if possible. And the ACE wrap should be gently tight, not enough to make the toes turn blue, to have good circulation in the toes, but pretty firm otherwise. There will be bruising. The blood vessels break, small blood vessels, blood leaks out. The ecchymosis or bruising frequently goes to the most dependent area. It will start in one area and it will just drift down from gravity to where it settles down. Your white cells come in and eliminate the breakdown products of the red blood cells over time, clearing up this bruise, usually over a week or two. The small blood vessels tend to repair within 24 hours. This is the most critical time to try to stay off of it, to keep the pressure in your foot lower, and to keep your foot elevated about the level of your heart. Here you see a diagram, a schematic of the ligaments that attach the fibula, the outer bone, long bone of the lower leg, to your ankle. When a person inverts or turns their ankle inwardly, typically either running and hitting an uneven pavement or stepping off a curb the wrong way, sometimes in a sports injury, it is easy to extend the ankle, the ligaments, beyond their normal elastic recoil and break some fibers, break some blood vessels within the structure, and do some temporary damage. The anterior talo, the talus is the bone that sits above the calcaneus or major heel bone, to fibula, the long bone of the leg on the outside. This main ligament is the normal ligament that is first to be disrupted when you have an inversion injury. You can also have atypical sprains where the ankle actually turns to the outside, pulling the ligaments on the inside beyond their limit. You can also have a sprain, a high ankle sprain. Generally, this is more of a disruption of the ligaments of the tibia and the fibula, these main bones, long bones. And this is from a very forceful twisting of the whole foot, usually a sports injury. This anatomy shows the navicular bone, and the navicular bone is sitting right below the talus in front of the cuboid bones. It's critical to check the navicular bone for pain as one of the potential areas for fracture. Also on the fifth metatarsal, the bone that leads up to your little toe from your cuboid bones, the proximal portion of this portion towards the heel is a common area for a fracture that can occur in the twisting process as the outer side of the foot hits and steps down onto pavement or a hard structure. There's a general set of rules called the Ottawa ankle rules for determining if you need an x-ray. To do this, I just need to feel the posterior, the back edge of your fibula, the most common place where you might have a fracture, and on the metatarsal, the bone going from the cuboids down to the toe, on the little toe side, that area closer to the heel is a common place for a fracture as the bone turns out, so we'll palpate there, as well as in the forefoot at the navicular bone. So once we ascertain that it's unlike you need an x-ray, we can hold off on any exam like that for a while. In the event that there's question, we might get ultrasound if it's available to look at how intact the ligaments are to determine the degree of tear of the ligaments, and we might get an MRI as this progresses if it doesn't heal as we expect it to. It's important to look at comorbidities. Do you have nutritional problems of overeating, putting undue stress to your ankles? Do you have nutritional problems of not eating enough protein or other parts, other essential nutrients to make your structures good and intact. Neurological deficits have a large spectrum of possibilities, from loss of sensation resulting in the sprain, to poor balance resulting in tripping and sprain, to loss of judgment to allow you to go ahead and do something you shouldn't have done. Alcoholism can present just as an ankle sprain, as a person losing control of their judgment, overindulging too much. So about a week out, we'll get you into rehabilitation. Most important is, in general, to be doing ample stretching. Now, if the ligament has laxity, is overly loose, we don't want to stretch beyond that. We want the opposite. So that's why you have to be evaluated. And we'll refer you to a physical therapist for this. We may see you back to reevaluate you ourselves. So strengthening exercise, stretching exercise, and perhaps weight reduction, perhaps addressing neurological disorders. I hope that helped. Understand, follow the fundamentals, try to get it elevated at the level of your heart, ice it if you can, ACE wrap, all the first 24 to 48 hours. That tends to lessen your total convalescence if you can do that early on. Thank you.